Mr. T is a 75-year-old male who has recently been widowed. He lives alone in a condo at a retirement community. He interacts with neighbors, attends Catholic church, identifies strongly with his Hispanic roots, and loves his children and grandchildren. Up until now, he has managed his chronic hypertension and diabetes with medication. He speaks with his daughter by phone. They are discussing his granddaughter's upcoming quinceañera and his recent health issues.
Mija, how are you? I can't wait to see my granddaughter at her quinceañera. I just hope I'm not feeling like this when I'm playing with the mariachis.
Why do you say that, Papa? What's wrong?
I'm so tired. I'm supposed to be getting ready for the fiesta, and all I want to do is take a siesta. Oh, and my estomago. I feel so queasy. I miss Mama's food.
Oh no, Papa. Are you throwing up? I'm going to make sure your neighbor checks on you.
No, mija, I'll be fine.
1 week later, Mr. T is practicing his mariachi playing outside the condo to get ready for the quinceañera. He's going to play for her after church. His neighbor is watching and listening while he sings and plays guitar. He stops suddenly and starts looking around, seeming confused.
What is wrong? You sound great, Mr. T.
Oh, I don't feel so good. I'm not sure why the rest of the band's not here in the cantina. Are you looking for them too?
No, Mr. T. I just came over to check on you. Your daughter called.
Oh, do you know where I am? I thought we were at the cantina today. What time is it?
After noticing that Mr. T did not seem to know where he was, the neighbor called 911.
Help! We have an emergency.
Hi, Mr. T. What brings you in today?
Nurse Kina, what's wrong with Mr. T?
His chief complaints are nausea, fatigue, and confusion. He has a +2 Brui when we listen to his left carotid artery. His tests show that he has hematuria, or blood in his urine, and an abnormal white blood cell count. Mr. T needs help.
So, Nurse Kina, which of these signs and symptoms are you going to focus on for your nursing diagnosis?
We are focusing on his confusion, moderate blood in his urine, and abnormal white blood cell count.
All right, so the nursing diagnosis is infection, risk of related to unidentified urinary bacteria as evidenced by abnormal white blood cell levels and moderate blood in urine. Nurse Kina, what are we going to do to help Mr. T to feel better and get to his granddaughter's quinceañera?
Our short-term goals are to reduce Mr. T's signs and symptoms of infection. We will accomplish this by administering antibiotics as ordered, encouraging fluids as needed, and aiding reduction of confusion by actively reorienting the patient to time and place. We also will be assessing our success by asking questions to check for reduced confusion.
Fabuloso! Meanwhile, we're doing everything we can to make sure our patient is improving. Mr. T asks Nurse Kina what his long-term goals are.
So, Nurse Kina, what are you going to do to make me feel better for the long term?
Well, Mr. T, our long-term goal is to make you infection-free. We will accomplish this by monitoring all white blood cell values as ordered till they return to normal values. Monitor urine appearance for absence of cloudiness and return to a regular color. Monitor quantity of urine for signs of urinary retention.
Has our patient improved? Is he still confused?
Well, we performed our checkup, and good news, our long-term goals are met, as evidenced by absence of blood and cloudiness in his urine, and also a return of white blood cells to normal levels.
I'm feeling great. I can't wait to get out of here and start playing my guitar again.
No good nursing goes without good teaching. So what are we going to teach our patient?
Okay, drink plenty of fluids, especially water. Make sure you take all your medications as prescribed. Know the signs and symptoms of infection returning, and practice good personal hygiene.
Now Mr. T can take care of himself and the fiesta can begin. Yeehaw!